So our today lecture is Intro to the General Anatomy. So General Anatomy is our first section to the anatomy introduction. So anatomy means cutting up. So as you can see in this diagram, so we have cut open the abdomen and thorax of this patient. So but the more important or the more refined definition is it is a branch of medicine. So anatomy is a branch of medicine which deals with the study of structures. So in anatomy you can see here is our lungs, and we have to study its relation with the our heart, our liver, and our pancreas. So this is called anatomy, or simply study of the structures. So anatomy is subdivided into various categories. So our first category is cadaveric anatomy. So cadaveric means it is studying of dead bodies with the help of our naked eyes. Cadaveric anatomy is also known as microscopic or gross anatomy. So in our college we have anatomical labs in which the patients who die, they then donate their dead bodies so that it can be used by the medical student to study the anatomy. So it is studying on dead bodies with naked eyes. So it can be used in two approaches. So we have two approaches to study on the cadaveric anatomy. So the first one is regional anatomy. So we will study it by regions. So upper limb, lower limb, thorax, abdomen, and head and neck. So upper limb, it refers to the our hands. Lower limb, it refers to the our legs. Thorax and abdomen, it is this area, and head and neck refer to this area. So and the second approach is systemic anatomy. So we can use it to study the system. So the first one is skeletal. So skeletal system, muscular system, vascular system, or nervous system. So it has also other name, and like skeletal system is also known as osteology, and muscular system are also known as myology. So all these have different names. So now let's talk about the second classification of anatomy, which is living anatomy. So in this we study the anatomy on the living objects like humans. So it is done on living body. So how will we study the anatomy on the living? So it can be done by four different methods, that is inspection, palpation, percussion, and auscultation. So let's talk about inspection. So inspection is nothing but when we visually examine the body. So when we see with our naked eyes, so for example, when we are studying a living patient with their foot swelling, so as you can see, it is a foot, and you can see there is a swelling in the red color. So we can simply use our eyes to see the swelling. So this is the example of inspection. Now let's talk about palpation. So it is nothing but feeling with the finger or hand during a physical examination. So when we are examining a patient and we will use a finger, so suppose this is an organ, and we will lay our finger on the organ. When we want to, for example, if there is swelling of the organ, or and we can see the, if it is bigger inside, we can feel with our finger. The next method is percussion. So percussion is nothing but we tap our body, any body part, with our fingers, hand, or small instrument which produces a sound which can indicate the type of tissue we are pressing on. So as you can see in this image, a doctor is tapping behind the patient so that it can hear the sound to determine the type of tissue. For example, we tap on all the lungs which are hollow, as air is trapped inside them. Now lastly, let us talk about auscultation, because auscultation means We use the stethoscope to listen to the sounds of various organs like heart, lungs. So, and how it is helpful? We can determine the heartbeat monitoring using the stethoscope, which can determine the our heart rate condition, so that we can diagnose the cardiovascular disease risk. Now let's talk about a third subdivision, which is embryological or development anatomy. So it is a study of development of organism right from its birth till the adulthood. So when the baby is born till it becomes adult, so this is embryology, and it is subdivided into further ontogeny and phylogeny. So what is ontogeny? So ontogeny is development history. It is a study of development history, and phylogeny is study of evolutionary history. So it is simply means it is the study of development of an organism, and phylogeny is how the organism have been evolved. So this is the embryological anatomy. So we will discuss in another lecture. The fourth division is histology or microscopic anatomy. So we will have a separate lecture on this anatomy also. So it is when we prepare tissue slides and study them with the help of microscope. So when the slides are studied under the microscope, then this is the classify under the histology or microscopic anatomy. And next is surface anatomy. So in this we should know we should be aware of about some important landmarks of deeper parts of the body in relation to the skin surface, because they are clinical importance. So let's understand this with the example. So we can check dorsal pedis artery pulsation on dorsal side of foot. So this is our foot and this is the dorsal side, and there is a artery known as dorsalis pedis artery, and as you can see the person is checking the pulsation, because so this is a important landmark. So this artery gets hard in the diabetic patient. So in the diabetic patient we cannot feel the pulsation. So this is this artery is of very clinical importance, as it can tell about the condition of the diabetic patient. Our next category is radiographic anatomy. So it is a study of bones and deeper organs with the help of X-ray, ultrasound or CT scan. So as you can see, this is an X-ray, anterior posterior X-ray, and you can see these are our lungs, and here is our diaphragm. So this anatomy includes the study of bones and deeper organs. So this is the branch, and the seventh branch is comparative anatomy. So it is the study of anatomy of other animals by comparing it with the human anatomy. So as you have seen in the earlier days in the medical colleges, rats are dissected. So it was the part of anatomy study, but now it is not rats are not dissected. And the last is applied anatomy or clinical anatomy. So this is the very important. So we will studying this portion only. So applying anatomy knowledge to medical or surgical practice. So it is used in the surgical practice or medical. So for example, a blood vessel damage, it can cause the hypertension. So if we know the which blood vessel is damaged, then we can track why it is causing the hypertension.